You know that feeling, right? That discomfort, that bloating, or just that sense that something is off in your gut. It's so easy to just ignore it, but sometimes your gut is really trying to tell you something important. So today, we're going to pull back the curtain and demystify some of the most common and, yeah, some of the most serious intestinal conditions out there, from sudden blockages to those chronic issues. Okay, so here's our game plan. We're going to kick things off with what happens when your gut literally just stops flowing. Then we'll dive into the real facts on colorectal cancer and what happens after a diagnosis. From there, we'll talk about the daily challenges of IBS, and we'll wrap it all up with the most crucial part, how you, yes you, can take back control of your gut health.
I want you to picture a massive traffic jam on a highway, bumper to bumper, nothing moving. Now imagine that happening inside your digestive system. That's pretty much what an intestinal obstruction is. It's a blockage that stops food and liquid from getting through, and it can be a partial slowdown or, way more seriously, a complete standstill.
Now, these traffic jams in your gut come in two main flavors. Over on the left, you've got your mechanical obstruction. Think of this like a fallen tree, blocking the entire road. Something is physically in the way. But then on the right, you have a non-mechanical obstruction, which is often called a paralytic ileus. This is more like a power outage for the whole traffic grid. The road is clear, but the muscles that are supposed to push everything along have just stopped working.
And what's really wild is just how many different things can cause that physical roadblock. The number one cause, believe it or not, is adhesions. That's scar tissue from a previous surgery. But you can also see tumors, hernias, even really severe constipation on the list. Let's take a quick look at two of the more unusual ones.
First up is this mouthful, intussusception. It sounds complicated, but the idea is actually pretty simple. It's when one piece of your intestine literally slides into the part next to it, just like you'd collapse an old-school telescope. You can see how that would immediately create a major blockage.
And then you've got this one, volvulus. And this is just as dangerous, if not more so. It's when the intestine twists on itself. The best analogy for this is a bad kink in a garden hose. Not only does it stop anything from flowing through, but it can actually cut off the blood supply to that part of the bowel. And that, right there, is a true medical emergency.
So, some of those blockages we just talked about can be caused by tumors, and that brings us right to our next big topic, colorectal cancer. Now, I know the word cancer is always heavy, but if there's one thing you take away from this section, let it be this. Colorectal cancer is one of the most preventable, and when you catch it early, one of the most curable cancers there is.
But we absolutely have to take it seriously. I mean, look at this number. It's the fourth most common cancer diagnosed in the entire U.S. This is not some rare thing, it's something that touches a lot of lives, which is why it's so critical to understand where it comes from.
For the vast majority of people, the story of colorectal cancer starts right here, with polyps. These are just small growths that can form on the inner lining of your colon or rectum. Now, most of them are totally harmless, but there's a certain type, called adenomatous polyps, that are considered precancerous. They're the ones we have to watch out for.
And this visual just lays it out perfectly. Cancer doesn't just show up one day out of the blue. It's a process. It starts with healthy tissue, then a polyp grows, and then, usually over a period of many years, that polyp can change and become cancerous. And you know, this slow progression is exactly why screening is such a game changer. We can find and get rid of those polyps long before they ever get a chance to become a real threat.
So, who's most at risk? Well, age is a huge one. The risk definitely climbs after you hit 45 or 50. And genetics, for sure, can play a big part, especially with certain inherited syndromes. But just look at the rest of this list. Smoking, obesity, diet, inactivity, alcohol. These are lifestyle factors. And that's actually good news, because it means they are things we often have the power to change. Okay, knowing the risks is one thing, but actually doing something about it is what saves lives. So let's pivot now from just understanding the problem to exploring the solutions, focusing on screening, treatments, and what life can look like after a diagnosis.
And the guidelines these days are clearer than ever. For folks at average risk, you should start talking about screening with your doctor right around age 45. You've got options too. from really simple stool-based tests you can do at home every few years, all the way up to a colonoscopy every 10 years, which is kind of the gold standard because it lets doctors find and remove polyps in the very same procedure.
Now, in some cases, treatment for colorectal cancer or other gut issues might involve a surgery called a colostomy. And this procedure creates something called a stoma, which is simply a new opening on the abdomen for waste to leave the body. It might be temporary or it might be permanent, but either way, it's a truly life-altering and life-saving adaptation.
Okay, and this is incredibly important. While living with a stoma becomes routine for most people, there are a few critical red flags to watch for right after surgery. A healthy stoma should be a reddish-pink color, kind of like the inside of your mouth. If you ever see it turn a dark red, purplish, or black color, or if there's heavy bleeding, those are signs it might not be getting enough blood. That is a true emergency, and you need to call the surgeon immediately.
All right, let's shift gears. We've talked about some really serious, life-threatening conditions. Now let's turn to something that, while it's not as severe, affects millions and millions of people every single day. Irritable bowel syndrome, or IBS. This is a chronic condition that can have a huge impact on a person's quality of life. At its heart, IBS is what doctors call a functional disorder. And what that really means is the gut looks perfectly normal. There's no visible damage, but it just doesn't work properly. And the classic symptoms are right there. Chronic pain, bloating, and this big shift in your bathroom habits, swinging either towards diarrhea or constipation.
And here's the key thing to get about IBS. It is not a one-size-fits-all diagnosis. It's usually broken down by the main symptom. So you have IBS-C, where constipation is the big problem, and the treatment plan focuses on things like fiber. And then you have IBS-D, where diarrhea is the dominant issue, and treatment might involve anti-diarrheal meds. And of course, some people have a mix of the two, just to make it extra fun.
So, whether we are talking about preventing blockages, slashing your cancer risk, or just managing chronic symptoms day to day, it all comes down to this final and I think most empowering section. How can we actually be proactive and take control of our own gut health? Not surprisingly, it so often starts with what you put on your plate. A diet packed with high-fiber foods is a huge help. It keeps things moving, which lowers your risk for constipation and even colorectal cancer. And of course, you need plenty of water to help all that fiber do its job properly. Cutting back on certain fats and things that make you gassy can also make a world of difference for a lot of people.
And it goes way beyond just your diet. Regular exercise is fantastic for keeping your gut moving. Maintaining a healthy weight lowers your cancer risk. And you can see how all these other points tie back to everything we've talked about. Not straining helps prevent things like hemorrhoids. And quitting smoking and limiting alcohol are two of the absolute best things you can do to lower your risk for colorectal cancer.
You know, when you really think about it, our bodies are almost always giving us little signals long before a problem gets serious. A change in habits, that nagging pain, that persistent discomfort, it's all a form of communication. So the most important takeaway from all of this is just to pay attention. Listen to those signals and don't be afraid to talk to a doctor when they don't go away. Your gut is talking. The real question is, are you listening?